Hi, good morning. Welcome to Raaonline. I am Dr. D. Malarviri, working as professor in Sri Balaji Dental College. This lecture is on diseases of pulp. Before we go into the lecture, let me give a little food for the thought. Train your mind to see the good in everything. The happiness of your life depends on the quality of your thoughts. So let's start with some positivity. These are the contents of my presentation. I will be talking about basics of inflammation, causes of pulpal diseases, how pulpal diseases are classified, and various types of pulpal diseases with each one in detail. First, let me give a case scenario where a patient reported with severe sharp lancinating pain in forceps, that is the lower right first molar tooth, for past 3 days, and the pain increased on having hot food. When I took radiograph, there was dentinal caries involving the pulp. Other structures appeared to be normal. With electric pulp test, the less current was required to give the response. What could be the diagnosis? Okay, let's see whether you're able to answer at the end of the lecture. Pulp is a formative organ of the tooth. It forms primary dentine during tooth development, secondary dentine after tooth eruption, and reparative dentine in response to stimulation. When someone helps and protects us from bad impact or injury, they have a special importance in our life, isn't it? Similarly, this pulp is very important to the tooth. Though enamel and dentine are present, pulp definitely has a special place. So what happens when there is bacterial infection in the tooth or inflammation? When there is an injury, inflammation is triggered. When the bacteria or the bacterial byproducts enter into the pulp, there is complement activation and there is cellular response. So the polymorphonuclear neutrophils, macrophages and plasma cells reach the site of inflammation. When these cells reach the site, they release oxygen-derived free radicals and try to combat with the bacteria and the bacterial byproducts. At the same time, there is vascular response, there is vasodilatation and stasis of blood at the site. So when there is vasodilatation, the endothelial cells lining the blood vessel, they contract and they create gaps between the cells. So what happens is this plasma enters from within the blood vessel into the surrounding intrapulpal tissue. So there is increase in fluid within the intrapulpal tissue causing edema, resulting in increase in intrapulpal pressure. And at the same time, there are release of certain inflammatory mediators at the site of inflammation. There is release of bradykinin, prostaglandins, leukotrienes from the arachidonic acid and cytokines. So these inflammatory mediators are responsible for the response of pain. So whatever may be the response, whether heat or cold or pressure, the tooth responds by pain. So normally the pulp can withstand heat up to about 60 to 130 degree Fahrenheit. Whereas when cavity is prepared, the heat produced during cavity preparation can reach up to 10 degrees centigrade. When it is within 10 degree to 20 degree centigrade at 1 millimeter from the pulp, definitely the pulp can withstand the temperature changes. But when it goes beyond this, then the pulp responds by triggering the inflammatory reaction. So this is what happens when there is inflammation within the pulpal tissue. Next, let's see what are the causes for the pulpal diseases. It is broadly classified into physical, chemical and the bacterial cause. In physical, again, there are various causes like mechanical injury, thermal injury or electrical injury that can result in pulpal disease. In mechanical, the various factors that can cause injury are trauma. When I say trauma, it could be because of the accidents that can occur during sports activities, or it can even be a iatrogenic cause. Iatrogenic cause means it is induced by the operator during some treatment on the tooth. So when there is rapid tooth movement during orthodontics, or when there is rapid separation of the teeth during restoration, or when the cavity is prepared without an air coolant, all these can cause trauma to the pulp. The pathological wear like attrition or abrasion can cause loss of enamel and dentine as well as injury to the underlying pulp. There's a term called as cracked tooth syndrome. What does this mean? If the tooth is fractured incompletely, it is called as cracked tooth syndrome. This condition may not cause pain or any symptom in the tooth initially, but over a due course, it can cause, when it becomes complete fracture, it can cause pulpal pain.